Welcome to Performance Science, a podcast exploring the science of performing and the role of performance in society. I am Professor Aaron Williamon, head of the Centre for Performance Science, a partnership of the Royal College of Music and Imperial College London. Here in the Centre for Performance Science, our research examines and reflects on what performing can tell us about how people interact, develop, work, learn, and play. In this series, I'm interested in exploring how performers support their own well-being, as well as how they meet the distinctive and sometimes intense challenges of their work. In this first episode, we will look at research conducted as part of the Hearts Professional Project. HEART stands for the Health, Economic, and Social Impact of the Arts. HEART is a large research initiative that has been led by the Centre for Performance Science since 2018. We're investigating the impact of the arts and culture on health and well-being from individual, social, and economic perspectives. Hearts Professional, more specifically, is a project that set out to examine the well-being of performing artists in response to the COVID-19 pandemic. We have been working to understand the effects of the pandemic on the well-being of performing artists and what these effects can teach us about how to support resilience within performing arts communities and the wider cultural and creative sectors. We heard directly from performing artists about the emotional vulnerability that can sometimes accompany artistic expression, often delivered in the spotlight of public scrutiny. We heard how the very nature of the performing arts sector and the UK's creative industry landscape can influence their well-being, and sometimes not for good, as can be the case with the instability of freelance work. The data that we collected show us not only how performing artists' well-being changed, and in some cases did not change, but also the different factors that can impact well-being over time. For performance scientists, understanding these levers for well-being is a crucial part of understanding performance, what drives performers, and how we can support performers of the future. My guests today are Neta Spiro, researcher at the Royal College of Music, and Rachel Warr, puppeteer and performer in residence in the Centre for Performance Science. Rachel, can I start with you? Could you give us some information about what a puppeteer does in daily working life?
Oh, well, it's not typical. Daily working life is very varied. I think that's one of the things that has brought me into the work that I do. It's a very changeable kind of schedule, I guess. Puppeteers generally are handling puppets or objects, bringing them to life or movement to form a narrative or a dialogue. And so my work, actually most of the time I'm working as a puppetry director. I do puppeteer and perform, but most of the time I'm working with other puppeteers to help them with their performance. So as a puppetry director, I'm developing the concept or the script for the performance. I'm putting together the team. I'm liaising with the venue and the marketing. I'm working closely with technical and creative teams, so the designer, the composer, and of course the performers. And then in rehearsals, shaping the artistic content, and then project managing that through to post-production.
What are some of the stresses and obstacles that you sometimes face in trying to achieve that goal that you may have for a public performance?
Undoubtedly, the funding situation is always challenging in the arts. And I think in recent years, it has made it much harder for things to not work well straight away. You have to work really efficiently. There are expectations that you will have outcomes and results without difficulties. There's much less leeway for experimentation or for things to be trialed and for things to go wrong or to not be easy. And that's a huge pressure. You feel that you have to come to the work having done an awful large amount of preparation. You have to come to the work with having done lots of preparation before the funding is even in place. So you're working speculatively with high risk. That project might not happen, but you're putting a lot of hours in to ensure that if and when you do get that funding, it will click into place. It will work well.
Thank you. That's a fantastic insight into the world of puppetry, but also not only just the skills which underpin successful performance, but some of the opportunities and challenges that I think performers have to go through in any field when they are looking to put their skills out in front of the public. So Neta, if I can now turn to you, let me ask, why should we support performers' well-being?
Yeah, so I think Rachel has already mentioned a lot of the key stressors. But as the World Health Organization and many others have pointed out, mental health is an integral and essential component of health, and that's no different for performers. But for performers, maintaining well-being can be really challenging. And there can be a range of pressures that can negatively affect well-being, some of which Rachel has just mentioned. And research has documented issues of income, so these kind of financial pressures, issues of job insecurity and unpredictability, issues of short careers. And there are also the physical and mental stresses of the work itself and of the conditions of work. Artists of different kinds, performers of different kinds can experience high work demands and low social support. There can be complex relationships and there can be a huge amount of self-criticism. So, and we've seen in the past research documenting occupational demands being linked to poorer well-being among performing artists. And this is particularly ironic, perhaps, for performers in a profession that's providing so much entertainment and joy and helping people feel good, and often helping others support their own well-being.
So underlying pressures, for sure, there are, but we also went through the pandemic where there were particular instances of a real shock to the system. Rachel, could I ask you to talk about how the pandemic itself had an impact on your work?
Well, theatre is a collaborative process for the most part, and often in person. And the pandemic, of course, shut all of that down. It was isolating with lockdowns, and it wasn't possible to work with other people in the same way as before. And of course, there was a kind of lack of focus and purpose. Nobody really quite knew how long this would last or what might happen. And I appreciate that different people had different experiences during the pandemic. Some people found that inward-looking, quiet time very positive to be creative. But for many, I think that was actually very tricky. I think it became very easy to get rusty. I think the artistic muscle needs continual practice and exercising and an audience. And all the sort of networks that existed seemed to shut down or close. And I think that was partly that there'd already been limitations to those with austerity and cuts, but the pandemic was sort of a nail in the coffin for many of those.
Neta, could you tell us a little bit about the Hart's professional research that examined different types of groups, how different types of performing artists were affected through the pandemic? Do we see a similar picture from all facets of the performing arts area, that similar to what Rachel's just described, or is it really quite specific to the field that we focus on?
That's a really good question. So just to give a bit of context, we put out surveys to performers in the UK 3 times during the pandemic annually, right from the beginning, to trace how things kind of progressed for them. But these were snapshots, so it's just a kind of little snapshot every year. We started with just having 300 participants, and for the last survey, we had over 650. We expected at the beginning maybe that there would be different groups that might react differently. And so we spread this as widely as we could across the different performing arts. And we found, actually, to our surprise, that when we looked at our health and well-being outcomes, it didn't seem that the area of work was a good predictor of how people were going to be feeling. So musicians responded in the same way as other performing artists, and so on. Well, where we did find group differences was looking at experiences of financial hardship. So the biggest proportion reporting financial hardship were the performing artists, with over 3/4 of them having financial problems. And so, as you're saying, really, Rachel, I suspect that these differences could relate to how this work is generally set up before the pandemic, how reliant people were on income from other than the arts in the first place, how public-facing their work needed to be to get paid, and how easily those parts of their work could go online, or how easily they could kind of bolster their online aspect of working as compared to their in person.
Could we go back to the long-term impacts of these that we might draw from these results here? So if we're looking to change the way that we support performing artists, change the way that we educate and train them, the way that we write policies for them in terms of supporting them well. And I think it is important to do that because supporting our artists means that we're also supporting the health of society more generally. What are those long-term changes that we can begin to make that could really affect positively the way that we train, support, and also empower artists moving forward?
So if we're going to look to policy or to other kind of higher level plans around supporting our professional artists, the first key thing is financial stability, it seems. There's a need to look for better funding models. Ideas that have been proposed within our project are to do with basic guaranteed income, minimum pay protections for creators, targeted tax relief, and flexibility of funding models more generally. But there needs to be some quite long-term thinking now, I think, about how we support the arts financially in the UK.
Could I ask you both to reflect a bit on what society gets from a well performer? So clearly we work within the arts. We are engaging with performance a lot. We have a lot vested in making sure that we are working in a sector that's financially stable, that has good support for its performers. But what about people who don't work in our sector? What do they get from a well-thriving performing arts sector and an arts sector more generally within the UK?
Well, all of society is a connected group, and the arts often are the thing that allows people to make contact with other people, to find connection, to share an experience, whether that's as an audience experiencing an event or whether that's engaged in some kind of participatory work. And the arts are really, they're a glue for a society or a community or a group of people. They remind us of what makes us human, why we are like we are, what experiences we have through our lives.
Yeah, I think I obviously completely agree. I think from the research perspective now, there's so much evidence, both from the kind of large-scale surveys and large-scale work that's looked at people's everyday engagements in the arts, anything from listening to their music on their, I was going to say iPods, that's dating me, on their phones, right through to going to formal events at concert halls and theatres, right through to the cinema and everything beyond. And the connection between those activities that people choose to do, maybe on the face of it for other reasons, and the effect that it has on their feelings of social connection, on their feelings of mental well-being, and on their reduction of the more negative symptoms of depression and loneliness and other such symptoms. So we know that exists, that research base is out there now. So
let's just think about moving forward at this point. So we've been through this shock of the pandemic. There were tremendous effects financially, health-wise, throughout the performing arts and wider arts sector. We see a rebounding within the wider creative industries financially in terms of the economics, with gross value added to the economy changing since 2019 by really outstripping the rest of the economy. It's a tremendous impact there. To focus on that is only to know the cost of the performing arts without knowing its actual value, however. And what you've just described are a number of ways in which the arts bring people together. I mean, you mentioned the phrase glue, but the arts can be a mirror, it can be an amplifier. There are a number of ways in which it can engage, inspire us, interact with us, train us, and bring us together. It would be a pity if this particular shock to the system left long-term detrimental effects, and we aren't really to know yet what those effects or how they will play out. But I would like just to focus on where we go from here. What can we take from that experience?
Several things emerged from our research, I think, that made me think that the need for research in this area is still there and urgent. One area, I think, is that it was only through these large-scale surveys that we could even get a sense of where people were. And as I mentioned before, there weren't really differences between the groups, the different artistic groups at that big level. But there are differences between subgroups in different ways. So age played a really important role. Younger people scored less highly on our measures, so they were experiencing worse mental health symptoms. And men on average were scoring better on some measures than women and others. So there are these varieties within the bigger population that, from a research perspective, we need to delve into now in more detail so that we can begin to understand what the individual experiences are from different perspectives. And I think that's going to be a kind of fundamental, important next step in order to be able to work together with performers to understand how they can support each other and what kind of mechanisms we can put in. I don't want to give the impression that we as researchers come in to these helpless people that need some kind of support. No, there's lots of resource out there from different perspectives, lots of experience. As we saw in the pandemic, there's lots of flexibility, lots of agility. But what are the kind of large-scale things and tailored things that we can learn about through research to try and help support people as they go through their professional lives?
So, Rachel, working in that freelance way, if you had a conversation with yourself 20 years ago, what would you tell yourself to prepare you for this type of work and perhaps even allow you to work more effectively then as well as you do now?
That's a really difficult question. Well, I suppose early on I had a clear sense of where I thought I wanted to get to in career terms. And that role no longer exists. I mean, it just doesn't exist. So when I was a 20-year-old or whatever, I would have said to myself, you know what, don't hang on to that. And actually don't remember that you're doing this because you love it, because you enjoy it, because it's part of your need to express, rather than a sense of a career ladder. I think midway or some way in, I started realizing that I was getting incredibly frustrated and unhappy, and realized that actually I was losing sight of why I was doing the work, and that it didn't matter if I was at that venue or this venue or under a contract of this kind or the other kind. And but it took me a while to learn that and to realize that actually, if you lose sight of the fact that you're choosing to work in this field and the uncertainty of it, you have to make a strength. You have to accept that you're not quite sure where the next money's coming in, or that project is or isn't going to happen, even though you're working on it already. You have to accept those things and find a way to manage wider life in a way that is positive for your family and friends. That understanding that early on maybe meant I might have put slightly less expectation on myself, because by not having, I need to get to this point in my career and just enjoying it, actually that's where success comes, because you are invested in it emotionally and physically and, you know, with joy rather than trying to push and achieve.
Yeah, your point about the place where you thought you wanted to be no longer exists is something that I think a lot of performers may find. Not only that the jobs they may have thought they wanted when going through the training don't exist, but maybe they don't actually like those jobs when they get there. And Neta, you're doing a lot of work in terms of retraining and training some of our students at the Royal College of Music to go out and engage new audiences. Could you say a little bit about that?
Right. So we have a master's program here at the Royal College of Music, where people come in often after having, at the very least, an undergraduate degree and often way more experience in one form of practice or another. So we have everything from musicians and teachers to nurses and people of the clergy, like the whole range. And they come in for a year with us. Or 2 part-time, and they get experiences of different forms of thinking about performance science very broadly. And so the course that I teach is on performing arts and health and well-being. And so we send people out into the community to go see and sometimes contribute to arts and health work, community work. And the number of people who have come into the course never really having heard of the existence of this work. And they come to me at the end of the module and it's piqued their interest. A lot of people now are going in and learning more about what's available for them in that area. And some just are much more aware of the kind of wide variety of the roles that performing arts can play. So it can be quite a big change for people, I think, when they're coming in and they see that new aspect of performing arts work.
Yeah, it's clear that as educators, as researchers, as policymakers, we need to work better and more effectively at helping performing artists not just survive, but to thrive. And that then has an ongoing impact on public health and the health of society more generally. Rachel Warr, Neta Spiro, thank you very much. Thanks to production support from Caitlin Shaughnessy, Frederick Lamb, and Michael Durrant of the Center for Performance Science, Nick Flatt at Panda, Chris Garrington of Research Podcasts, and the Arts and Humanities Research Council for their generous support.